Welcome to Healthier. This is Dr. Isaac Opoku-Asare. Thank you once again for joining me this evening for another wonderful session. And this week we'll continue our discussion on what we started, I think, 2 weeks ago, which is plaque buildup, which we went through and understood that this is not simply an issue of clot formation, but it's a process that started some time ago. I want to thank all my listeners, and I want to thank my producer, Mr. Blake, for all the wonderful work that they do. And that has made it possible for us to be able to come to you. And I will also encourage you to send us any questions that you have or anything that you have that will enable us to be able to answer them more importantly and also improve what we're able to deliver to you. So if you have any questions, please send to the number. We'll make the number available. I think is going to come later on the screen, and it's something that you can share with other people and want to hear from you. This is very important to us. Time and quality goes into what we do, and that is why I want to make sure that it will go a long way to help you. Let me tell you why. You see, let me tell you why we do this program. The reason, what I found in medicine, I mean, through my teaching in the medical school and also teaching residents, fellows, and all the way up to doing procedures in people's heart and all those things, I realized that when patients come to us, we speak in a language that is a little bit difficult for patients to understand. But I always tell my patients that you are your own doctor first. Your first doctor is you. And because you are your first doctor, you need to have adequate information about yourself. And then together with your doctor, you will take appropriate decisions or appropriate actions to help you. And that is why everything that is happening to you, it is important for you to know. Because if you're having symptoms of heart attack or you're having anything and you do not know, you may delay your coming to the hospital, and that may be a problem, you know. Not too long ago, we had a situation of somebody coming to the hospital, and the person was talking about, I'm having a shortness of breath. But that person that was supposedly having shortness of breath, if you look at what happened, when you looked at what happened, I mean, that has been going on for some time. But either the person did not realize what was going on or downplayed what was going on. And unfortunately, it led to an outcome that was not good, because by the time that the person was able to get to the hospital, it was too late. So you are your own doctor first. I say this to my patients a lot. And then together with us, we work together with you to be able to provide you the optimum care. So before we continue our discussion on atherosclerosis, I want to talk about something that is going on concerning the COVID-19. And it's important because, I mean, COVID-19, as you know, can by itself cause you to have heart attack. It can cause the enzymes for heart attack to go up. It has various mechanisms by which it can do that. And that is why we believe that COVID-19 is a very important part, because people who come is a very important part of cardiovascular care. And people who come to the hospital where the COVID-19 has a manifestation that it has attacked the cardiovascular system, they don't tend to do well compared to probably other patients. So it's a very, very important thing to always keep yourself updated. And that is why I want to talk a little bit about some of the issues pertaining to COVID-19 and cardiovascular outcomes, and then we'll go to atherosclerosis. So specifically, a lot of people are worried about the flu that is coming as well as the COVID-19. But let me tell you this. There is a good thing about what we are going through in terms of protection. So in the peak of the flu, one of the things we do is what we are doing now. Washing your hands well. Washing your hands well will help you. If you are doing it to prevent COVID-19, that will help you prevent the flu. If you are wearing a mask, that will also prevent you from the flu. So the good thing is that even if we are looking for a vaccine and a vaccine comes, it does not mean that we should move away from the things that we do, like washing of hands and all the appropriate measures, right? When you go home, wash your hands. Before you eat, wash your hands. Hand washing is so important. And these things will help us. So it is taking one stone to prevent one stone to what? To kill two birds. And that is why instead of we being worried about, okay, we're going to have a double whammy, right? We're going to have a double whammy of COVID-19 and the flu season coming together, and is going to destroy the world. I don't work with such expectation. I believe that the God that I serve and the God that probably you also serve is a good one, and He has given us the wisdom to be able to make the appropriate decisions. So the precautionary measures that you take, I believe that it will go a long way to prevent both the flu and the COVID-19. So don't worry about it. Rather, take the actions that are appropriate, that will help you to be able to stay healthy and to prevent that. At least for those of us in the northeastern area, at least in my hospital, the numbers seem to be going down drastically, and that is a good sign. But these things, I believe that at least at the end of the day, certain attitudes about us as a society in terms of hand washing and being careful about what you are touching and all those things should stay with us, because it will go a long way in sort of keeping in check the transmission of these viral conditions, so that we can deal with them even better going forward as individuals and also as a nation. So I hear this a lot. And I also want to encourage you, if you are an elderly person and if you are a healthcare worker, I'll strongly encourage you to get your flu vaccine. I got my flu vaccine the very first day that my hospital issued the flu vaccine. I got it. So I've got my flu vaccine, and I'm telling you. So if you're eligible for the flu vaccine, get it, so that you build your antibodies right away. You can go through the season of the flu without any problem. So these are two things that we'll talk about a lot. Don't delay in those things, and rather take action, because action is what makes the difference rather than a mere talk. And that's why I decided to get my flu shot before I talk to you, because I want to be a good example about the things that we'll talk about. And we do put these things into practice, those who have worked with me will tell you that as part of my healthy lifestyle that I want to sort of keep on doing, I try as much as possible to avoid elevators. I don't take them, because everywhere I go, if I can within a building, I want to walk. And sometimes I come from the basement to what? To the set floor. And it's all part of using every opportunity to lead a healthy life. That is the point that I'm making. So I think we've talked about the COVID-19 and its relationship. So let us move to the arteriosclerosis. So as you can see on our picture over here, as you see, what is arteriosclerosis? It's a plaque buildup. So go back to what we talked about the last time. Is the fact that this process starts early. Please. And that is why everybody needs to listen to this. I'm going to give you an opportunity. We'll go for a short break and listen. If you look at what is going there at 20 years, so if anybody that is listening to me is 20 years, if you have a friend that is more than 20 years, if you have a child that is more than 20 years, it is important that you call them to listen to us this evening, even as we're going to finish this discussion on plaque buildup, which doctors call arteriosclerosis. The goal of this program is to break things down for you so that you will understand and make good decisions. And as I said, if anybody is more than 20 years, this plaque buildup may probably be there. But you know what? We have solutions to them. And that is why we have programs like this to come to you, to be able to help you make the right decisions. So we'll be back after a short break.
Zoe Light Radio.
This is Zoe Light Radio.
So welcome back. Thank you very much for joining me. I hope you're able to call your friend, share what we are doing with other people. So let us look at what we talked about and then move forward from there. So we said that the reason why people, one of the major reasons why people get heart attacks is driven by a plaque buildup. So what is a plaque? As you see in that picture, right? You see the normal blood vessel and at the beginning when the person is born, and all based on all the food that we eat. And I want to put it this way. It is not just the cholesterol, let me put it that way, but cholesterol and any excess excess calorie, it can all build it up. But this is the cholesterol that builds up in you. So if you have excess calorie, in your body, it's going to convert it to fat. And fat is what? Is the cholesterol that will build up in your other systems. So at the age of 20, it starts build up progressively. So let us go on to what we were the last time, and specifically, we want to highlight this picture. You see the picture that we want to show you here. You could see that this is how the plaque builds up. It's not completely open. You see the lipid core. We talked about the lipid core. That yellow thing is the cholesterol that has been built. A lot of people think that the cholesterol is just flowing in your blood. No, it's flowing in your blood, but that is not the one that kills you. Actually, when it flows into the blood and it gets to the liver, next time I'm going to come to you with other pictures to enable to help you understand these things. But the one that causes damage is that the blood vessel that goes into the heart, you see, the cholesterol gets inside it. And when it gets inside it, you only need one cholesterol to enter. Then it's going to invite more and more of them into the blood vessel, the wall of the blood vessel. So when it goes in there, and we talked about it the last time, that one of the things that happens here is that it is covered by a thin cap. And that thin cap, if it breaks out, as you see in the B, when it breaks out, the contents of the blood is not supposed to come in contact with the plaque that has been built in the blood vessels. And when they come together, they form a clot. So most people that get heart attacks, it is coming from the formation of the clot on top of the plaque. So let's say that somebody had 40% plaque buildup in their blood vessels that goes to the heart. And that cap on top of it ruptures. All of a sudden, a clot will form on it, and that will lead to what? That will lead to 100% closure. But there is good news. And that is why I like this picture from New England Journal, because I want to always give you the best literature that you can go with. So look at this. You see, you realize that it is not only the question of a plaque, the plaque that you see here. There are a number of things that are going on. So you see over here that on the left side, there's something written at TPA and UPA. So what is TPA and UPA? TPA and UPA are the normal things within your body that breaks down the clot. And you also see that there are other inflammatory cells, which is called monocytes and neutrophils. So why am I telling you all these things? It is because of this, that within your body, there is an ongoing process in most people sometimes of plaque, a little bit of plaque rupture and a plaque healing. And most of the time, what happens is that the healing process is able to overcome the fissuring or the erosion of the top of the plaque. So this is the beauty about the work of God, that within us there is already healing processes that is taking place every day. And what you need to do as an individual is to take the appropriate action so that what God has already put in there, it is going to what? Is going to be enhanced. So that is why I was talking about it the last time, that if you've already had a heart attack, there are certain medications we'll give to you. That it includes what? Aspirin and Plavix. They are there to reduce these platelets that are formed over there in your body, to reduce the tendency for you to have what? For her to have a clot on top of the plaque. And you have the UPA and the TPA that I talked about. And the other things that we don't talk about here is the inflammatory ones. So why is the inflammatory things important? Because when you have things like diabetes, right? Diabetes, if it's uncontrolled, right, it enhances these inflammatory factors in your body, and it will tip things from the healing aspect to the plaque buildup and the clotting aspect. So I tell my patients who come to me, they come to me and people refer them, okay, he's complaining of chest pain. The guy is complaining of chest pain and his other things. And if you look at him, his hemoglobin A1C is 13. I tell the patients, you need the diabetes doctor than me. Because no matter what I do, the process of inflammation that is being driven by the diabetes that is in you will overpower anything that I do. So you need to get the diabetes under control, because inflammatory agents are very much important part of the process of plaque buildup. And that is something that people do not understand. Now we have trials to show us. There are trials that have been done to show us that using anti-inflammatory agents can reduce the incidence of having another major heart attack in you. Specifically, I can quote the trials to you. One of them is the Cantos trial, where they use a medication they call the canoniculum, and the other medication that they also use, that medication we use for gout, right? Just think about it. When people have gout, there's an inflammation of the toe. When you give them colchicine, what does the colchicine do? It reduces the inflammation. So it's a good anti-inflammatory agent. And now we have shown in the COLCOT trial, COLCOT trial, that was published not too long ago, it showed that the administration of colchicine, which is an anti-inflammatory agent, is something that can cut down the incidence of having a myocardial infarction or having a heart attack. And this is very important. So it tells you that it is not only a matter of controlling your cholesterol, but other conditions that can increase your inflammatory condition. So long ago, they did a study, and in that study, they looked at an inflammatory marker. We call it this CRT, high sensitive CRT, which is a marker of inflammation. And it was known that people who have high levels of CRP, it's not CRT, of your CRP, they have a higher tendency of having a heart attack. Very interesting. So there is another study that they did, and they realized that, we call it the Jupiter trial, that showed that if your CRP is more than 2, and even if your cholesterol is not very high, but your cholesterol is sort of moderate, having a CRP of more than 2 with that is having evidence of inflammation in your body, in addition to a level of cholesterol that is not even too high, sort of intermediate, it leads to more heart attacks. So it is important when you're talking about plaque buildup that you also reduce anything that causes inflammation. And in this particular situation, it is the diabetes and other things, okay, that lends itself. Smoking, right? Smoking You should avoid it because it all adds to the milieu that makes the plaque unstable and causes it to rupture. When you see these pictures, you understand why it ruptures. And then we will go back to that picture again. The reason why you see that blood sitting on top of it is that the plaque that was built up had ruptured. So things that contributed to it is not just the cholesterol. If you cut down your cholesterol, then the other thing that you need to also do is to also avoid the smoking, whether secondhand smoking, control the diabetes, so that the inflammatory factors over here will be also reduced. And that will keep the plaque stable in addition to reducing the cholesterol content that is in them. So under normal circumstance, there is a healing and rupturing process that is going on. So if you realize, if you see the picture on C, what you're going to see that this person, though they have cholesterol plaque, there is a layer that has been formed over it. Look at our picture very well, and I want us to keep our picture here. It is important. You see that there is a collagen layer that has now been laid nicely on top of it. Why do we have this collagen layer laid on top of it? The collagen layer is laid on top of it so that the plaque that is there does not rupture, because the rupturing of the erosion of the plaque is the problem. So this is why patients come in and they say, my cholesterol is okay, so I need to stop taking the cholesterol medication. The answer is emphatically no. I want to repeat this. I can repeat this 1 billion times, because the reason why people get heart attack is that at the end of the day, that layer that is covered, right? The cholesterol medications that we give, specifically the atorvastatin, the statins, atorvastatin, rosuvastatins, in addition to reducing the cholesterol that is in your blood. The reason why that is important is that the more you have in the blood, the more it's going to get into the blood vessel. It also is being shown to reduce the burden of the plaque of the plaque that you have. And more important, we call it the pleiotropic effects, which is that it also stabilizes the plaque that you see over here. Because when that covering is gone, once again, you're going to go back to the previous picture where the contents of the plaque that is there is what? Is going to come in contact with the blood, and that leads to it. So it is important that even if your cholesterol is controlled, I'm leading you to 3 things now. It is the cholesterol level, it is the inflammation level. So the cholesterol is, and finally, it is how much cemented the plaque in you is. These 3 things are the most important things to guide you in making a determination. So let us look at the last picture here in D. I like the picture in D a lot. So somebody who has healed very well is that though there is cholesterol plaque, the cholesterol plaque may never go out of your body. Once it's there, but the growth can be suppressed by the medication that is being given and by the appropriate dietary patterns that we've talked about. We'll come and talk about dieting, give us some time and we'll talk about that. But we want to talk about this, and we're going to talk about PAD and talk about other things in terms of the trials that came out. But everybody, our goal is that even if your cholesterol you've got some amount of cholesterol, and cholesterol is good because you need it for your cell body, your cell wall. That cholesterol should be nicely covered by the normal blood the lining of the blood vessel. So if you look at this picture, you realize that on the left and the right, you see these cells that is covering it. That should be the normal covering. And hopefully it comes and covered the cholesterol plaque. And when it covers it, that is where we'll talk about the fact that it protects you from having further episodes. Because people have come to us and asked us this question. Oh, my cholesterol was okay. So why is it that his cholesterol was okay and he still ended up having heart attack? Because the cholesterol number may be okay, but at the end of the day, if the plaques are not stabilized, it can still rupture for the heart attack to occur. The cholesterol number may be okay, but the other factor is that your good cholesterol is still on the lower side. And the good cholesterol helps to keep the blood water. Take the cholesterol out of the blood and take them to the liver. So these principles are very important. So let us go on to the other things here that will help you in terms of driving home. Look at this picture. It's a lot of people. This is what we want to do. If I were you, I would like to be on the right side. I would not like to be on the left side. Why is that important? This is a picture. And there's a picture about reducing your inflammatory factors, the diabetes, the smoking, and the other conditions that increases your inflammatory status. Because you realize that if the person's inflammatory status and all these things that you're seeing in this picture, right? All these agents are inflammatory agents that are in you that stimulate the plaque to rupture. But if you come to the other side, on the right side, what you see over there is that it is nicely covered. So you have to ask yourself, where do you want to be in this picture? And if I were you, I want to be on what? I want to be on the right side. And being on the right side, it comes from weight control, right? Because when your blood sugar is not controlled, your blood pressure is not controlled, all these uncontrolled things, they can damage the lining, and it allows more cells to enter the lining. But your goal is that you control these factors, and it's going to help you. So let us move on here to what do you do about this situation? Number one, I just want us to go back and then based on the things that we have here is going to give you an idea. So let us go back and look at the other picture. Your goal here is that this is, if you look at the pictures, two pictures side by side, and it's telling you what we want or what you will have to be. The worst situation is the people on the left, right? Where they've got a lot of plaque that is built up in there. And in addition to that, the covering of the plaque is so tiny. And that's why I'm saying that sometimes even if the cholesterol level is not high, yet your inflammatory status is high, and the covering, what is the cap, is thin, it can lead to breakup. And when it leads to breakup, there's a problem. But look at the other side. No cholesterol buildup. I don't think we have these people in America now, if you're more than 20 years, because of probably the way we live. And you come here and you see that he's talking about plaque instability. Look at the picture. Why did we have plaque instability? Because at the end of the day, the thin covering over it broke up. And when it broke up, now a clot forms on it. So you have two situations where the thing will erode by itself or the thing will break up. And that leads to this condition. So all these principles, you see here he's written, I want to show you this picture because of this reason. The people who get heart attacks, they are on my right side, on the lower side, that specific area. You see the clot is beginning to form and it's trying to occlude. And that is why the person will get chest pain. And that is the reason why the person will have no blood flow in the legs. That is why the person will not have no blood flow in the brain. And that leads to stroke. And if you come to the other side, though you may have cholesterol in your body, this is not a time to raise up your hand and say, I'm giving up, because there can be complete healing that occur in you. And if you look at the other side, there has been complete healing and the cholesterol is being kept in check. And that is what we want you to do. I'm showing in these pictures to motivate you, for you to understand that no matter the diagnosis that your doctor has given to you, that your cholesterol is high, if you can do the things that we talk about, the 7 pillars of ideal cardiovascular health, they will go a long way for you to move from the picture on our left to the picture on our right. Where even though There are several risk factors that as you have, they are all kept under control. So you see how nicely the body has formed a new covering and kept the cholesterol in check. That is where you want to be. Even when it is all, you have already been told about that. You know, not too long ago, a patient met me and he was telling me how he's at home and worried about, he's having hand numbness in the hand, a little bit tingling in the heart and in the chest. And she's worried. And I was telling her, but if you are worried, why are you not doing the right things? And the patient was telling me, what do you mean by the right things? And I said, okay, if you are worried, why are you still smoking? Because he was trying to tell me that, oh, I'm trying to stay away from fatty food. And I said, that is not enough. If you are doing that, you've done well. But that person that I'm talking about, he weighs almost like 400 pounds. As I said, it's good that you are staying away from fatty food. But if at the end of the day you stay away from fatty food and consume the carbohydrates in very high amounts, it's coming back to square one. So why are you smoking? And why are you not keeping the weight also under check? So you need all those combinations to keep the inflammatory status also what? Down. So the things that we talk about here, the reason why I wanted to do the discussion is that appropriate lifestyle together with your medications can go a long way to reverse the plaque buildup in your body. So controlling the calorie amount that you eat will make it less calorie available for them to be converted to fat in your body. So I'm going through the pillars of ideal cardiovascular health to finish here. So that is why I talked about the fact that you need what? You need to control the weight. That is why we talked about the fact that you need to control the diet. We'll come to dieting after going through other topics. That's why we talked about avoidance of smoking. And that's why we talked about controlling your blood sugar. If you do these four things, then it will translate in the fact that your blood sugar is what? Is controlled. And if the blood sugar is controlled, most of the time your inflammatory factors will be down. That will lead also to the fact that your blood pressure is what? Is controlled. And that will lead to less damage to the lining on top of the plaque. Right? And that is going to help you. People will call it what? Endothelial damage. And then, we already talked about it. Ultimately, the buildup of the cholesterol itself is going to go down. There is hope for everybody. And I want you to know this. Why is exercise important? Exercise is important because it puts all these factors into place. Exercise is the ultimate. Why? Because it gets the inflammatory factors down. It bends the fat to go down, right? So if you look at all these things that we talked about, one thing that puts them all together and keep them all in check, your calorie content, your burning of the fat in you, all these things, exercise puts them together and make them what? Make them helpful to you. So adding exercise to diet control, to weight control, as well as what? Controlling your calorie amount will help you move, even if you had a heart attack in the past, to here. So cholesterol buildup, I want to end it by saying this. This buildup of cholesterol occurs in the what? In the blood vessels, in the neck, and in the brain that leads to stroke. The blood vessels in the legs, the blood vessels in the abdomen. And for any man that has ever smoked, I want to say this. If you are more than 65 years and you are listening to me, and if you have a parent that is more than 65 years that has ever smoked, it is very important that you share this discussion with them so that they talk to a vascular doctor, somebody who is good in vascular medicine or vascular practice, to check and make sure that the blood vessel, what we call the aorta, is not dilated. Because this plaque buildup in the stomach causes it to dilate or to blow out, and in other areas it causes a blockage in it. So we will end our discussion on arteriosclerosis on plaque buildup, which occurs in every blood vessel. Every blood vessel, specifically what I mean is that it occurs in the arteries. So by taking care of plaque buildup in your body, you protect your brain, you protect your heart, you protect the blood vessels in your abdomen, right? And you protect the blood vessels in your legs. Let me give you this. I want to end with this. You know, a guy came to me. Whenever he eats, he gets pain in his belly. Whenever he eats, he gets pain in his belly. So he went to see the belly doctors. And the belly doctors checked him. And one of the belly doctors felt that, this may be a plaque buildup. And you know what? The patient had the blood, as I told you this, everywhere blood vessel goes to, a plaque buildup can occur. And when he came, within your gastrointestinal systems, there are 3 vessels: the celiac artery, the superior mesenteric, and inferior mesenteric. What was happening is that he had significant plaque buildup in all the 3 blood vessels that supplies the intestine. And whenever he eats, because he needs more blood flow, he gets belly pain. So the guy could not eat. And he had grown so lame. We fixed him. And when we fix it, we fix the SMA. And when we fix the superior mesenteric artery by opening it up with a stent and putting them on cholesterol medications, the guy was able to eat and enjoy life. I hope this discussion on plaque buildup has been helpful to you. Next week, we'll be talking about plaque buildup in one specific session that is in the legs and in the belly. It's called peripheral vascular disease. And if you have anybody more than 50 years, I would strongly encourage you to ask that person to listen to us. It is known that almost 50% of all African American men above the age of 70 have got this condition. And if you have that together with blockage in your heart, it portends to things that are not good. But as I say, we are here to talk about hope. So even if you have the condition, listening to us and taking the appropriate actions will help you to move into a stable state that you don't need to worry any longer. Thank you very much. And thanks to my producer who has worked tirelessly to bring this program to you. We'll see you again next Tuesday and next Saturday here on Healthy Heart. God bless you. God bless America.